Right. Today we discuss the perceptual problem, the visual spatial problem, the end visual perceptual disorder. Today, visual perceptual problem we are going to discuss. First one, figure ground discrimination. The figure ground discrimination also the normal people also having this thing. But the brain injury person who are having some form of figure ground discrimination dysfunction is the problem. Figure ground discrimination dysfunction is the problem. Second one, firm constraints disorder. It is also the dysfunction. Firm identification and constancy disorder is the dysfunction, is the difficulties of the patient. Third one is spatial relation. Also we are having this spatial relationship, but is spatial relationship dysfunction is the problem patient having. Topographic disorder, the topographically we can understand the several pictures and areas and pathways and left right all other things. The topographical dysfunction is the disorder, is the patient having is the difficulties. Depth and distance identification, depth and distance and depth and vertical orientation identification is the normal person having these things, but difficulty, depth and distance and vertical orientation identification, difficulty is the patient having some form of dysfunction. Right, we are going to discuss one by one. Figure ground discrimination, firm constancy disorders, spatial relationship dysfunction, topographic disorder, depth and distance, vertical orientation dysfunction is the main subtopic of the spatial relationship dysfunction. 1, 2, 3, 4, 5, 6. Right, one by one we are going to discuss. First one, figure ground discrimination dysfunction. Right, when we are talk about the figure ground, the normal person know the figure and ground. Ground always the color also the connect these things. Figure is the ground. When they see the ground, there are some form of figure. The lot of figure we can this ground. The normal person can select the what is the on thing figure. For the example, we are going to there is some form of rack. There are several equipment in this rack. This is the doll This is the car. This is the teddy bear. This is the book. This is the clock. This is the scissor. This is the paintbrush. This is the glass. This is the flower bouquet like vase. This is the spoon, and this is the hammer. This is the cup. A lot of art there in the rhyme. When the figure ground discrimination, when we see these pictures, we can one by one select. But figure ground dysfunction having patient can't select this in this equipment. What is the glass? Glass is this. He can't quickly select some form of the 5 second likewise can't select this glass. Can't select this teddy bear likewise. A lot of equipment in this rack can't quickly select the object. That is the for the example, and we can apply these things to tackle the problem. Figure ground discrimination. Right? Another thing I am going to discuss. This is the combination of these pictures. This is the combination. This is the hammer. This is the paintbrush, and this is the spoon, and scissor also here. Combination of all these equipment. There are 1, 2, 3, 4 equipment. But figure ground discrimination dysfunction having patient can't tell these equipment. The 1, 2 he can tell, but all this equipment can't tell. Just the another example how to assess the figure ground discrimination patient. This is the 1, this is the 2. Right, we are going to the another example, give the another example. Figure ground discrimination. When we are talking the same color places, the snake, I am going to tell some form of the. We can also sometime to can't understand the figure ground area, right? This is the black snake. black snake the breakdown also the round shape and the some form of leaves and some form of branches, some form of dust collect area. The snakes also the inside this area, but suddenly we can't understand there is a snake in this area. This is also the figure ground problem. Another example. This is the flower. This is the flower. Butterfly also the same color. This is the butterfly. Butterfly also the same color, red color. We can't suddenly identify the red color flower. The butterfly also the inside this flower. This is the figure ground can't understand clearly red color to red flower. This is the black color to black color area. This is also the figure ground discrimination problem. Right? Okay, another example. This is the your table inside the room. The on the table there's some form of dressing is the blue color. The on this blue color dressing there's some form of small equipment. Sometimes blue color DVD on the blue color is the table. Suddenly we can identify the blue color table on the blue color DVD, CD disc can identify. That is also the figure ground discrimination problem. Right? Another example we are going to discuss. This is the your kitchen. When you have a lot of mix in the kitchen. Another one is the lot of color mix in the dressing problem. We wearing what color dressing and how to select the inside the rack, what is the color and what is the use selection dressing into same color. That's the problem. When the kitchen, this is the kitchen activity, how to select sugar and salt. That's another problem. In sugar and salt, the suddenly can't select. The some people make tea. They put the salt and mix, give the salt tea. That's the problem. When the some form of food making the food, put to the sugar. inside. Right, this is the in the kitchen activity when we are happening this incident. Now another one we are going to discuss the dressing problem. There's a rack inside the same color dressing. This is the same color dressing. When we select the same color dressing, the on dressing can't select quickly inside this area because of the all are red color and red color t-shirt can't select this rack. Right, the lot of we discussed the figure ground discrimination dysfunction. Another one. Consider the book rack. This is the rack. Several books are there. Sometimes the same color, the several colors. When we how we select the uh, quickly the medical dictionary from this book rack. There's another problem, the figure ground discrimination problem. How to select the dictionary from the book rack. Right, figure ground discrimination, get some form of little bit idea about this figure ground discrimination dysfunction. These are some form of several dysfunction. Consider the making your kitchen and washroom same color. That is the problem, same color. The tiles also the same color. Commode also the same color. The tap also the same color. The brush also the same color. The lot of are same color. This is the same color area. Some form of this dysfunction having patient can't select quickly what is his wanted area. The brush, when we are considering the brush, right? Go to another example. This is the brush put to this basket, and this is the tool, some form of tool. This is the bucket, same color brushes are there. So this brush is the nail polish brush. The other brush is the toothbrush. The other brush is the dressing cleaning brush. The other brush is the common cleaning, or likewise the sink cleaning brush. These all brushes are together. When this figure ground discrimination dysfunction having patient can't select his toothbrush, that's the difficult problem. The same color things inside the box, how to select the toothbrush. That's another example. Figure ground discrimination dysfunction. This is another example. When we are talking about the artists, this can arts are beautifully. The nature and pictures and flowers are beautiful arts. But this figure ground discrimination dysfunction patient can't select the proper arts brush, painting brush. to this box to red color brush to the paint in red color, and white color brush to the paint in white color. Likewise, the suitable brush can't to select. This is also the figure ground discrimination dysfunction having patient. We can assess the patient, the apply these several point we can apply and assess the figure ground discrimination dysfunction having this patient. That's the figure ground discrimination dysfunction. The next one we are going to discuss the figure ground discrimination dysfunction having patient when they went to the shopping. That's the lot of complex inside the shopping, because same color things and what is the on things, and the dressing when they went to the dressing complex, the how to select the dressing, that's the dressing problem also, the having this figure ground discrimination dysfunction patient. Right now we are going to the next one. Next one is the form constancy. Form constancy dysfunction. The form constancy dysfunction. It is another one we are going to discuss. The form constancy ability normal person having, but the form constancy dysfunction having the some form of brain injury or middle cerebral arterial damage patient. Right, we are going to discuss the one by one about this form constancy dysfunction. Form, size, shape, location. So these are some form of dividing form. The form is some object makes some special form, like dress. Some making the dressing, the tactile he can firmly identify. These are the dress. Size, some form of if is small equipment. The toothbrush can tactilely identify. Phone can tactilely identify. Pen can tactilely identify. A small clip can tactilely identify. Identity card. The lot of person they hanging some form of bag. They take some money also. The money also they can tactilely identify. Size, money. When I put the bag inside, then go here and there and take some form of identity card like this. Phone, pen. The normal person can be tactile identify firm. This is a firm constancy dysfunction having patient can't tactilely identify what is the firm thing. For the example, we are going to the firm equipment. When the hanging bag, this is the lady hanging this bag. Inside the bag, this is the pen. This is the ID card. This is the phone. This is the small book. This is the hair clip. Hair clip inside the bag. This is the rubber band. This is the handkerchief. Likewise, a lot of inside the bag. The firm constancy patient can't put the bag inside the arm, put the bag and select ID card. He can't select the identity card. He can't select the pin because of the tactile can't identify the form. This for the another example, firm identification. Another special activity. This also connect a lot of things. This is also the when we are doing inside the our therapist room also. This is the box. The several shapes and shapes are there. Right, round shape. Right, this shape. Right, this shape. This is the box. This is several sizes and shapes are there. There are some several peg also like these shapes and size peg. Those are three defects. Along height and distance, weight also there. This firm constant dysfunction patient can't to select these things and what is the put framework he can't identify. This is the selection can't identify the what is the frame of the put this object. This is the firm constant dysfunction having patient can't do it. This selective framework and selective object put the selective framework. That is the most important. Another point, size, shape and location problem. We can identify these things. Right, the form constant dysfunction. This is also the we can apply the figure ground discrimination also. The figure ground discrimination. The safe identified and put. This is scan. Selective places. And we can color adapt to the and color identification method also that we can put this box. A lot of work can adapt to this device and give the some form of patient. Right. Another one we are going to discuss the some form of shapes identification. How the shape. This is the round shape, triangular shape, rectangle shape, oval shape, diamond shape, hexal shape. Likewise, several shape. This is the 2D shape. Several shape. I can't identify give this fashion. What is this? Is the round? Is the triangle? The rectangle, oval, the diamond. Likewise, several shape can't identify. This is all the form constancy and shape identification problem. Right. Location also to connect this thing. This one to locate this thing and can't location identification. Alright, this is the form constant dysfunction. Now we are going to the next one. The form constant patient. These patients, some form of this patient in the hospital, a lot of like to touch some form of dress. Always they try to dress in touch and tactile dressing stimulation. When you are see these patients, they are always touching, dressing, and their shirt always touching and stretching. We can identify the form problem having this brain injury patient. This is the most important thing. This point. Right, when we are going to the discuss spatial relationship. Dysfunction is the problem. Spatial relationship dysfunction is the problem. Spatial relationship is the most important when we are doing to the ADL activity. A lot of are connect to the ADL activity, or lot of are connect to the instrumental ADL activity. The previous, the money handling also the connect the previous. Brushing also the connect the previous. The tactile lot of having the when they doing the, in your cooking activity, kitchen, this is cooking activity. The lot of tactile identification most important. When the when we are talking the relationship, spatial relationship is the most important the kitchen activity. Why? The front side identification, the back side identification, left side identification, right side identification. This is subtitle we can wrote the left right discrimination. When we are doing to the, this is the cooking table. This is the driving car. Yeah, I'm going to give the some form of the little bit identification, discrimination problem, spatial relationship. When the cooking table, the front side, this side and that side, back side, this is some form of gas cooker also there. This is some form of rack, this special rack, the salt, sugar, likewise things, and vegetable fruit, likewise things. This is the cutlery and knife equipment also there. The front side is the tap area. This is the tap. When the spatial relationship problem having patient can't identify which side is the cooking gas cooker, which side of the which side is the vegetables, and which side is the cutlery equipment, knife. When it's take and finish this activity and again it's fixed to the same place, not to the fixed same place, here and there, anywhere in the equipment, everywhere we can see the cooking activity. The front side, left side, back sides, up sides, down side, when the spatial relationship problem having this patient. We can assess this patient. This is some form of small activity or some form of we can assess the own body also. This is the own body. And ask the patient to touch or raise left side arm and touch left side ear and touch left side hand and touch left side equipment and takes right side equipment. Likewise, we can assist the patient to using some form of activity. This is driving. Driving also the most important to is spatial relationship. when these special relationship dysfunction having patient can't to drive, why when he driving the same line but he can't to turn to the left side and turn to the right side, what is the left side, what is the right side, that's the problem. And when the light signal, this is a red light on, the go to and fix the brake, that is the problem. Can't brake apply to the normal distance and beyond the red light and go for far away to the brake apply. With some form of accident can be happen to the identify the distance in between accident equipment and this car. This is the special relationship most important to discuss area. These are inside the home. How the special relationship identification inside the home. When walking inside the home, they go to the some form of uh, draw. He can't go through the draw because of the some form of little bit move to here and there and knock here and there his leg and arm, and that's the spatially he can't identify the distance. When he is take a glass of water, there is another one, this is the glass of water on the table, reach in this glass of water, they can assess this also, the cooking activity also, this is the problem. Reaching the glass of water, underreach can happen, overreach can happen, suddenly knock to the glass, that is can happen. Sometimes he go to the under the table also, there is another problem, reaching problem. This is also happening to the this special relationship or dysfunction problem, right? A lot of there are the special relationship dysfunction when you are talking about the lot of the marketing. When the supermarket going to the supermarket, there's to take some form of thing to how to distance to take these things and how to reach this area, that's the problem. The draw closer area, how to go through the and left side, where's the left side, where's the right side, then how to go. The picture card apply to the this patient to go road, that's the most important to identify the picture card system to left right and spatial relationship identification, right. These are the some form of several things. Now we are going to the spatial relationship dysfunction. Left right discrimination is the most important. Another one we are going to discuss, position in space. This is the spatial relationship problem have patient can't to position in space problem is the most important to discuss. When they are coming to enter to the some form of draw, and sweepers must remove, and they remove the sweepers, and how to fix this sweeper to the sweeper rack, that is the problem, the position in space, how to put the sweeper rack, where they are putting these things, that's the problem. Spatial, the position in the space, that is also the most important. When we are the he's a teacher, is there is some form of rack, This is the book rack. A lot of books are there. The separate area. There are separate area to grade 7 books, grade